Good afternoon and good morning, everyone, depending on where you are joining us from. My name is Priya Shah from the Association of State and Territorial Health Officials. Thank you all for joining us today. In this 30-minute webinar, we will be providing an overview over a newly co-developed toolkit from the Association of State and Territorial Health Officials, also known as ASTHO, and Alzheimer's Association, focusing on the topic areas of dementia, cognitive health, and caregiving. We will also conduct a few demonstrations on how to best utilize some of the resources in this toolkit. Throughout the webinar, if anyone has any questions, please feel free to add those to the Q&A box, and we will continue to answer those throughout as well as at the end of the webinar. Next slide, please. Presenters for today's webinar on the Needs Assessment Toolkit include John Shan, Associate Director, Healthy Brain Initiative at Alzheimer's Association, Talia Sands, Director of Health Improvement at ASTHO, and myself, Priya Shah, Analyst on the Health Improvement team at ASTHO. We would also like to acknowledge Kelsey Donnellan, a former Health Improvement team member and now Director of Island Jurisdictions Health Improvement at ASTHO, for their support in bringing the toolkit to fruition. Lastly, we would like to acknowledge and thank CDC for our cooperative agreement that makes today's webinar possible. Please know that the content and views expressed throughout the webinar today are solely those of the presenters. Next slide, please. Start off with an overview of the toolkit. Community needs assessments are commonly conducted for conditions like stroke, heart disease, diabetes, and others, but as public health agencies, it is important to leverage our networks, advocacy and policy advising efforts, and our systems perspective to advance cognitive health. This toolkit guides multi-system teams from public health agencies, aging agencies, community organizations, and other institutions through the steps necessary to conduct a comprehensive needs assessment of dementia, dementia caregiving, and cognitive health in their communities. The toolkit is designed to be used in conjunction with CDC's and Alzheimer's Association's Healthy Brain Initiative Roadmap, also known as the HBI Roadmap. And for those who do not know, the HBI Roadmap is a series that aims to prepare governmental and tribal public health agencies and partners to change policies, systems, and environments regarding cognitive health, dementia, and caregiving to improve population health. Toolkit also embeds health equity as a cornerstone to assessing community health. It offers approaches to operationalize equity in the assessment process by including wide representation of people from different racial and ethnic backgrounds, geographic locations, levels of socioeconomic status, and educational attainment. Next slide, please. I'll go over the intended audience. This toolkit is designed for a variety of stakeholders interested in conducting a needs assessment of dementia, cognitive health, and caregiving in their community. As you can see on the slide, I've listed a couple of examples of what this might look like. So the intended audience would be state and local health agencies and their staff, aging agencies, community health and hospital systems, community leaders, as well as Alzheimer's planning groups. Because of its modular design, stakeholders can enter at any point in their assessment process and can use the assessment process to inform jurisdiction and agency planning, which could look like planning specific to implementing the Healthy Brain Initiative, a state health improvement plan, a state Alzheimer's plan, or something else. Now I will pass it off to John to continue on with the organization of the toolkit. Thank you.
Great. Thank you so much, Priya. And hi and hello, everyone. Thank you for joining us today. Very excited to walk you through some of the actual structure of the toolkit itself, including how you may be able to utilize it in your own work. If you have clicked on the link in the chat, you'll see that the PDF of the toolkit itself is actually 33 pages long. I know that sounds overwhelming, but I really want to encourage you to think about the toolkit as really just a 5-pager. 5 steps, 1 page each, then with a bunch of tools and resources to help support action. So don't want it to be as overwhelming as it may appear on first click, because it is really structured to help guide you through the needs assessment process. So on your screen, you can see the 5 steps of the toolkit, which are really the crux of this process. I'm going to go over these in a little bit more detail in just a second, but I want to highlight that we specifically crafted each step to be achievable and to provide enough detail and guidance to set users of the toolkit on a path, on a good path without being overwhelmed. In the toolkit, we conducted a wide variety of consultations with stakeholders and with end users, those who would be most likely to use the toolkit or most likely to conduct the needs assessment. So the details and the guidance that we did include were specifically and specially considered and included to have the maximum benefit. On this slide, here you can actually see the 5 steps themselves. And as you heard Priya just say, depending on where you or your jurisdiction is at in the process, you can enter this toolkit at any step. So for example, if you are a state that would like to conduct this kind of needs assessment to inform a state Alzheimer's plan, for instance, and you already have an Alzheimer's advisory council or an Alzheimer's task force in your state, your jurisdiction may already have step 1, a partner step, fairly well covered. So moving on to steps 2, 3, 4, and 5 may be appropriate for you. As that modular design, it really allows you to tailor the approach and tailor the entry into this needs assessment at any point. I'm not actually going to go into too much detail on these individual steps. I encourage you to check out the toolkit for more information on each step, but do want to give you some high-level touch points for the entire process. So as you see on the screen, step 1 is partner. This is getting the group together that can and should be involved in the needs assessment process. This is a particularly important step from a health equity perspective to ensure that those who are most impacted by dementia, impacted by cognitive decline, impacted by caregiving, to ensure that they are included and really embedded throughout the entire assessment process. Moving forward to our blue section, our step 2 is planning, laying out the process for conducting the needs assessment itself. This is both very logistical, so who should serve on a core team, who would actually be moving the assessment process forward day to day, as well as aspirational. What are the goals and the objectives of the needs assessment itself? Thinking through not only who to reach and how to assess them, but then what should be done with the information once it is collected. And collected brings us to that third middle column there, step 3, which is the collect step. This is all about soliciting, collecting, collating the information. The appendices for step 3 include potential data sources that you can tap into for this process, as well as a heavy emphasis on collecting and assessing for health disparities and health status data. Once you have the data, step 4 is to analyze it. This step not only helps organize and analyze the data, all of the information you've collected, but it also guides you through the developing a recommendation or a set of recommendations based on the patterns and the gaps that the data reveal. Which brings us finally to step 5, our green step here, which is action. Taking the data, taking that analysis, taking the recommendations, and putting them into action. This step outlines not only disseminating and communicating these findings, but how to ensure that those initial stakeholders, those most impacted, are brought back into the process itself. And you heard me say, and I've mentioned quite a few times now, that there are a bunch of appendices. These are where the tools and the resources of the toolkit are held. You can see just a handful of them on your screen right now, but all of the tools are organized by step. So if, for instance, you're working on step 3, that collection step, the appendices have tools and resources that help provide the collection parameters to get a full needs assessment accomplished. Throughout the development of the toolkit, we focused a lot of time and attention on practicality, what information, which processes were needed to ensure success at each step. So the appendices that you'll find in the toolkit really take that focus and translate them into action. You're not going to need every tool at every step, but they are really there to assist you through the process. And speaking of process, I'm now excited to turn it over to my other colleague from ASTHO, Talia Sands, to take us through some of the more intricate items of the toolkit.
Thank you, John. Hi, everyone. Thank you for tuning in. I'm going to switch to a screen share of the toolkit itself. I'm going to be sharing a bit about some of the tools in the appendix, and in particular, an Excel file that is an alternative way that you can access some of the tools if you prefer to document through an Excel file or something that you can collaborate on with colleagues and even send the file out to partners. So we're looking at page 16 of the toolkit. This is where the appendix starts. You'll notice at the top here, there is a link to the Excel spreadsheet that's complementary to the worksheets in the appendix. When you click this link, you'll be taken to the Alzheimer's Association website where you can download the Needs Assessment Toolkit file. And then you can open up that toolkit or the Excel file and see some of the resources there. I will be switching over to that file in just a moment, but before I do, I also want to point out that any of the tools in the appendix that show up in the PDF and in the Excel spreadsheet are noted here at the top of that tool, linking again to the Excel spreadsheet. So there's really no wrong door to find your way to the tool in Excel if you're looking for that. I'm going to switch over to the Excel file itself to give you a preview of what that looks like. So again, I mentioned that there are a select number of the tools in the PDF appendix that show up here in this Excel file. We really prioritized those tools for which you need to compile information or answer questions that are kind of part of the brainstorming process that you might want to have documented in a file that you would save on your computer or again, share with partners or stakeholders. So I'll give you a brief tour of some of what's in the Excel sheet and then give a couple examples of some of the tools and how you might use them. So each tool that's in here is labeled on the tab at the bottom with the number and letter that corresponds with that tool in the toolkit. And I'll scroll through slowly so you can get a quick view. You'll notice there's spaces to respond to each of the prompts, as well as some instructions here. So you don't have to flip back and forth between this Excel file and the PDF toolkit itself. You can kind of use this as your guide and not feel like you have to flip back and forth. That's a quick view of how it's laid out. And I'm going to go back to Toolkit 1A, the stakeholder matrix, to give some examples of how you might use this spreadsheet. So this one should be pretty straightforward. Here on the left, we have a space to fill in contact information, or maybe you already have some of that information that you can import or copy from another file into here. And then you'll notice as we move along the right, there are some prompts to really think critically and brainstorm about your stakeholders. Think through, what do they have to offer? What are their priorities? Are there strategies you want to take into account of how to engage them? These are all prompts that will help you do some brainstorming and critical thinking about the stakeholder group. And then using this whole template, seeing all of the stakeholders that you have in mind may help you think about any gaps in the stakeholder group that you want to fill. Next tool I'm going to chat about is tool 2B, which is the assessment timeline. So if you are a lover of planning like me, this might be your favorite tool in the Excel file. The intention of this tool is to help you plan out step by step when things will occur. This sheet in particular is pre-populated with the steps of the assessment process that show up in the toolkit, and then the different activities that fall within them. So you don't have to recreate the wheel. And it gives you an opportunity, if you want to customize, add sub-steps, you're more than welcome to do so and add extra lines. So to give an example of how you might use this, let's say that John, Priya, and I are starting off on kicking off a needs assessment process beginning in April. We'll just look at April and May as our first couple of stopping points. So we'll look at step 1, partner. The first activity there is to identify stakeholders. And Priya has volunteered to be the lead. John will be the support role. And we'll take care of that in April, sorry. So I'll fill in that cell to indicate April is when that will occur. And then we'll move on to the next step of inviting stakeholders. And that will be led by John. I'll be in the support role at that point. And then we will take care of that in May, and so on and so forth. So great way to visualize when things will happen and jot down who will be responsible for what. Finally, I'm going to flip over to tool 5B, which is the communication planning tool. As John mentioned earlier, the final step of action includes some consideration of communicating and disseminating information back to different audiences. And so you'll see here that this tool helps you think of what needs to be communicated, who you'll communicate to, what methods you'll communicate through, who will deliver the message, when you might deliver that message, and any costs associated with doing that communication and dissemination. And then in the last column, there's a section to provide a chance to reflect on how that communication went. Was there any feedback that you got? Is there anything you want to note for the future to do some kind of notations for quality improvement down the line? So this is, again, a great tool to get you thinking, organized, brainstorming, and just thinking critically about what are the different pieces that go into tackling this step. You'll notice as well, we have a health equity tip, which includes, as we mentioned, being inclusive of people who are most affected by dementia, cognitive health, and caregiving as you take on this step in particular and throughout the steps. So lots of mirroring between what is in the toolkit and what is in this Excel file, just a different way to organize information if you're more interested in having it in a file like this to update and share. So I'm going to stop my sharing and ask John to go back to our slides. So while we get that pulled up, want to thank you again for joining us on this tour of the toolkit. If you do have questions, we will be taking some time for Q&A in just a moment. Please do add them to the Q&A box, and we'll get to them when we get to that point. But before we do, we are going to take a moment to pause for a mindfulness exercise. This is something we like to build in during our various sessions to take a chance to pause and just have a mindful moment. We know we all are very busy. We are still navigating through a pandemic, and it's important that we take the time to refill our cup, even for just a couple moments. So we will be doing a square breathing exercise, and as you can see, the square breathing follows this square on the right side of your screen, where we will inhale as we follow along the top part of the square, hold the breath as we move down the right side of the square, exhale along the bottom of the square, and then we'll rest with the breath out going up the left side of the square. I'll guide us through it. You're welcome to keep your eyes open, or if you prefer to dim your gaze, you're more than welcome to do so. But find a comfortable seat, plant your feet on the ground, and exhale all the air from your body. And when you're ready, start to inhale for 2, 3, 4. Hold the breath for 2, 3, 4. Exhale for 2, 3, 4. And then rest with the breath out for 2, 3, 4. We'll do it again for 2, 3, 4, inhaling, 2, 3, 4. Hold with the breath in for 2, 3, 4. Exhale slowly for 2, 3, 4. Rest with the breath out for 2, 3, 4. We'll go through one more time. Inhale, 1, 2, 3, 4. Hold the breath in for 2, 3, 4. Exhale slowly for 2, 3, 4. And rest with the breath out for 2, 3, 4. Just a natural breath in and out. Feel how that settles in your body, taking a moment to have some deep breathing. And then start to wiggle around, opening your eyes, maybe stretching your fingers, moving your feet, and come back into our space. All right. So next slide, please. We're going to now move into our Q&A. And so I'll keep an eye on those questions that are coming in. I know there have been a few that have come into the chat, and as best we can, Priya, John, and I will respond. So John, I see you came off of mute. Do you want to address one of the questions that came in, or have one you want to start with?
Yeah, thank you. And I did just want to add a quick note of thank you for walking us through that breathing exercise. I know it's I often don't take time for myself and my own brain during the workday, so I do appreciate having just a quick moment to do that. For the Q&A, I actually thought it would be great we had a question come in asking about stakeholders and who might be the best or who should be an included stakeholder throughout this process. And we actually do, I want to point folks to one of our appendices. It's actually Appendix 1C, Tool 1C. This provides some examples of the stakeholders who could be appropriate for the process, depending on the jurisdiction. And Talia and Priya, I'll invite you to add some additional commentary about these stakeholders. But the question itself centered on, should stakeholders include people who are impacted by dementia, living with cognitive impairment, caregivers, as well as should other groups who work with these populations be included? And the answer to both of those questions is yes. The needs assessment process is really about gathering the input, gathering the voices, gathering the feedback from those impacted, those most affected individuals. So certainly people who are living with dementia or living with another kind of cognitive impairment are essential to understanding the community impact of dementia. And so they need to be incorporated and included throughout the entire needs assessment process. I'm so glad to see that caregivers were identified in that question too, because we know that caregivers for people living with dementia are such an important integral component of their life together, that including their unique perspective, their unique needs, and their unique strengths into the process will yield much better data and results at the end. For the stakeholders on the organizations that work with these populations or have a vested interest in these populations, Priya or Talia, do you want to, you have great experience working with state health departments on this front. Any tips you would add for stakeholders in these populations?
I think you covered it well, John. I think it just depends on the jurisdiction and figuring out if you don't have a connection with those particular stakeholders already, figuring out what other stakeholders that you do know who might be able to connect you and kind of snowball that connection from there.
Excellent. Talia, which question do you see next coming up?
I see the question about, have any providers and health systems added the tool into the EHR? Seems these days they only do things that are prompted in the EHR for the electronic health record. That's a great question. I personally have not had that direct experience with what you're describing, Jennifer. I think that sounds like a helpful thing to perhaps assess in an assessment process like this, and maybe flag as a potential part of the action step if what you're finding is kind of prompting you there. Curious, John or Priya, if you have other thoughts or ideas.
Yeah, so to answer very narrowly, this toolkit is relatively new, so it in and of itself has not, I think, likely been incorporated into any electronic health record out there. But to the larger question, since nonprofit hospital systems under the Affordable Care Act do have a required needs assessment and health improvement planning process tied to the ACA requirements, these kinds of questions that come up on dementia, on cognitive impairment, on caregiving, these kinds of things are can and should be, from my perspective, can and should be included in that broader community needs assessment process. Whether or not they actually make it up to the level of being included in some kind of measurable way into an EHR is going to vary certainly by jurisdictions and by hospital systems. But I would say that is a ripe opportunity for, if you're working in that sphere, is a ripe opportunity for consideration. The more time and attention that dementia, cognitive impairment, that caregiving gets, particularly at that systems level, the broader reach, the better care, the better attention we'll have to people who are living with these conditions.
I also saw in the Q&A that we did get a question asking if any states have piloted the toolkit on any scale. That's a great question. We just released the toolkit officially in the last month or so. So this is the first time that it's gone public in a way that people can see the full toolkit and start to utilize it. We have not heard, at least I have not heard of any states that have piloted the process yet. However, we did, as John mentioned, get input from a variety of stakeholders, including folks from state health departments, state units on aging, on what content went into the toolkit, and then also in the review of the toolkit draft itself. So there's been kind of that input in the process to vet the process through what seems feasible for a state health agency or another state level partner to achieve. And I'll look to my colleagues, John and Priya, if you have other thoughts to add or even experiences from the past. This toolkit today that we're talking about is kind of a revision of an older toolkit that may have had some experience with traction, although it, of course, is a little bit different.
Yeah, and I'll quickly jump in on that front, because that's where my mind went, Talia. If you are out there currently listening to this webinar and you plan to use this toolkit, please reach out, please let us know. We're happy to provide additional support and technical assistance with it, and would love to see how the process rolls out. But as far as I know, as Talia mentioned, no one has yet taken this toolkit in and of itself and implemented it out in their communities, just due to the newness of it. However, that previous version of this toolkit we know that it was used in a handful of different instances, most notably in South Dakota, when they were pulling together their state Alzheimer's plan. They actually used our previous needs assessment toolkit to conduct a really robust needs assessment of people living in the state with dementia, with cognitive impairment, as well as their caregivers, and use that needs assessment over a many-month period to develop robust recommendations in the state Alzheimer's plan. Based on the report, and we can actually include this in a link when we follow up with the slide deck and a link to the recording. I can put a link to the previous report from South Dakota, because they did have, it's I think over 100 pages long, of the feedback that was collected via that needs assessment, as well as how those recommendations tie to the future state plan that was released. So we do know that this is a useful topic, and we hope with the new modular design with these 5 steps that it can be used by a lot of different jurisdictions in a very easy way to enter the process. Excellent. Well, it looks like we purposefully designed this as a very short webinar. We know everyone's time and attention is very stretched thin these days. So we do want to thank you for joining us. As I mentioned earlier, we will send out an email to all registrants with a copy of the slide deck, as well as a link to the recording after that gets posted, as well as additional links that we featured today. So thank you so much for joining us. We hope you have a wonderful rest of your week. Take care, everybody.